Hi everyone, welcome back to our channel. Today we will discuss about the most important topic MCQ Electroconvulsive Therapy ECT. First question, the primary indication for ECT is option A schizophrenia with delusion only, option B severe depression with the suicidal risk, option C generalized anxiety disorder, option D mild depression. The answer is option B severe depression with the suicidal risk. Option B is the correct answer because ECT is most effective for severe depression, especially when the suicidal or the psychotic features are present. Next, ECT works by the blocking, option A blocking dopamine receptors, option B including controlled seizure, option C increasing the serotonin breakdown, option D sedating the patient for long periods. The answer is option B inducing controlled the seizure. ECT induces brief controls seizure which alter the neurotransmitter activity and improve the psychiatric symptoms. So the answer is option B. Next, a major absolute contraindication for ECT is option A hypertension, option B recent myocardial infarction, option C anxiety disorder, option D mild asthma. The answer is option B recent myocardial infarction because cardiovascular instability increases the risk of the complications during the ECT. Next, before the ECT, the nurse should do a withhold all medication without instruction. Option B obtain informed consent and conducts pre-procedure assessment. Option C encourage patient to eat a heavy meal. Option D administer sedative without physician order. The answer is option B obtain informed consent and conduct the pre-procedure assessment because informed consent and the assessment are the critical to ensure the patient safety. Next, during the ECT, which medication is commonly given to relax the skeletal muscle? Option A atropine, option B succinylcholine, option C diazepam, option D morphine. The answer is option B succinylcholine because succinylcholine is a short acting muscle relaxant that prevents the injury during the seizure activity. So we are giving the succinylcholine, we are giving for the relaxed skeletal muscle. So answer is option B. Next, which anesthetic is commonly used for the ECT? Option A propofol, option B haloperidol, option C fluoxetine, option D lorazepam. The answer is option A propofol because propofol is a short acting anesthetic. Like propofol are used to induce the unconsciousness quickly and safely for the ECT. So we are using the propofol. So the answer is option A. Next, the nurse monitors which vital signs during the ECT? Option A only the blood pressure, option B pulse, BP, respiration rate and oxygen saturation, option C temperature only, option D heart rate only. The answer is option B pulse, BP, respiratory rate and the oxygen saturation. Option B is the correct answer, because continuous monitoring ensures that early detection of the complication during the ECT. Next, a common temporary cognitive side effect of ECT is option A, long-term dementia, option B, short-term memory loss, option C, permanent aphasia, option D, visual hallucination. The answer is option B, short-term memory loss. Short-term memory loss defects are the common but usually resolve within 1 week. So the answer is option B. Next, the nurse should instruct the patient to avoid which medication before the ECT? Option A, antihypertensives, option B, benzodiazepines, option C, antacids, option D, analgesics. The answer is option B, benzodiazepines. Option B is the correct answer, because it may reduce the seizure activity and the interfere with the ECT effectiveness. That's why patients should avoid this medicine. Next, which position is safest during the ECT administration? Option A, supine with head extended, option B, prone, option C, sideline with the pillow support, option D, standing. The answer is option C, sideline with the pillow support, because sideline prevents the aspirations during the seizure activity. So answer is option C. Next, the nurse should provide which pre-procedure instruction? Option A, fast for at least 6 to 8 hours, option B, take all morning medications as usual, option C, drink coffee to stay awake, option D, engage in the vigorous exercise. The answer is option A, fast at least 6 to 8 hours, because fasting reduces the risk of aspirations under anesthesia. So answer is option A. Next, which complication is the nurse most likely to observe immediately after the ECT? Option A, hypertension and headache, option B, chronic memory loss, option C, permanent cognitive impairment, option D, diabetes mellitus. The answer is option A, hypertension and headache. Transient BP and heart rate changes and headaches are the common immediately post ECT. So answer is option A. Next, the usual frequency of ECT sessions in acute treatment is option A, once a month, option B, 2 to 3 times per week, option C, daily for 1 month, option D, once every 6 months. The answer is option B, 2 to 3 times per week, because frequent sessions are required for the therapeutic efficiency during the acute treatment. So answer is option B. Next, which electrolyte imbalance increases seizure threshold and may reduce the ECT efficiency? The answer is options are option A, hyponatremia, option B, hyperkalemia, option C, hypocalcemia, option D, hypermagnesemia. The answer is option D, hypermagnesemia, because elevated magnesium can suppress the seizure activity, reducing ECT effectiveness. So answer is option D. Next, during recovery after ECT, the nurse should Option A, keep patient unsupervised. Option B, monitor for the confusion, headache and the vital signs. Option C, monitor, encourage immediately eating and drinking. Option D, avoid vital signs monitoring. The answer is option B, monitoring for the confusion, headache and the vital signs, because post-ictal monitoring is the ensure safety and early detection of the complication. Next, which condition is considered a relative contraindication for the ECT? Option A, recent stroke. Option B, severe depression. Option C, catatonia. Option D, mania. The answer is option A. Recent stroke increases the risk of the neurological complication during the ECT. So, recent stroke is totally contraindicated for the ECT. So, answer is option A. Next, the purpose of giving atropine before ECT is to, option A, increase the seizure duration. Option B, reduces secretion and prevent the bradycardia. Option C, enhance the muscle contraction. Option D, reduce the post-ECT anxiety. The answer is option B, reduce the secretion and the prevent bradycardia. Option B is the correct answer, because atropine decreases the oral secretion and the counters vagal stimulation induced the bradycardia. Next, a patient receiving ECT should be monitored for which cardiac complication? Option A, arrhythmias. Option B, myocardial infarction only. Option C, heart block always. Option D, only hypertension. The answer is option A, arrhythmias, because ECT can transiently alter cardiac conduction and the rhythm. So, answer is option A, arrhythmias. Next, nursing care post ECT includes, option A, immediate ambulation. Option B, protecting the patient from the injury and assisting with the orientation. Option C, administer sedatives routinely. Option D, limiting the airway monitoring. So the answer is option B, protecting the patient from the injury and assisting with the orientation, because post-ictal confusion requires supervision to prevent falls and the injuries. So answer is option B. Next, which is a common psychiatric indication for ECT besides a severe depression? Option A, panic disorder. Option B, schizophrenia with the catatonia. Option C, generalized anxiety. Option D, obsessive compulsive disorder. So the answer is option B, schizophrenia with the catatonia, because ECT is effective for the catatonia and treatment resistant schizophrenia. So the answer is option B. Next, the nurse should document which of the following during the ECT? Option A, seizure duration. Option B, patient only patient consent. Option C, only medication given. Option D, diet intake only. The answer is option A, seizure duration, vital signs and the complication, because comprehensive documentation is essential for the safety and the legal purposes. Next, which factor can reduce seizure quality during the ECT? Option A, anxiety. Option B, benzodiazepine use. Option C, proper fasting. Option D, pre-oxygenation. The answer is option B, benzodiazepine use, because it raise the seizure threshold and may reduce the therapeutic efficiency. So the answer is option B. Next, a patient asks about the long-term cognitive effects of the ECT. The nurse should respond. For the permanent memory loss is inevitable. Option B, short-term memory loss is common but usually resolves. Option C, no cognitive changes occur. Option D, IQ will permanently decrease. The answer is option B. Short-term memory loss is common but usually resolves. It resolves within a week only. Next, the type seizure duration during the ECT is option A 5 to 10 seconds, option B 20 to 60 seconds, option C 2 to 3 minutes, option D 10 minutes. The answer is option B, 20 to 60 seconds. Therapeutic seizure lasts approximately 20 to 60 seconds. Longer seizure may require more interventions. So next, pre-procedure nursing responsibilities include option A, removing denatures, glasses and jewelries. Option B, ensuring patient eats a full meal. Option C, avoiding consent. Option D, administering high dose sedatives. The answer is option A, removing the denatures, glasses and the jewelries, because it prevents the injury during seizure activity. Next, a patient develops post-ECT confusion. Nursing intervention includes option A, restrains the patient, option B, orientation and reassuring the patient, option C, ignoring the behavior, option D, immediate. The answer is immediate repeating ECT. The answer is option B, orientation and the reassuring the patient. Option B is the correct answer, because supportive care helps patients recover from the post-ictal confusion safely. Next, which pre-existing condition requires careful consideration before the ECT? Option A, hypertension, option B, glaucoma, option C, osteoarthritis, option D, seasonal allergies. The answer is option B, glaucoma. Because ECT increases the IOP, intraocular pressure, it is needed in the glaucoma patients, because its cautions is needed in glaucoma patients. Next, the nurse should assess which system post ECT for the potential complication. Option A, cardiovascular and neurological. Option B, only musculoskeletal. Option C, only gastrointestinal. Option D, only the endocrine. The answer is option A, cardiovascular and the neurological, because ECT can transiently affect heart rhythm and the neurological status. Thank you everyone. Please like, share and subscribe our channel.